Hello dear students, today we will talk about anesthetics. General anesthesia is a reversible state of central nervous system depression which causes a loss of response to and the perception of any stimuli. And it is used for patients undergoing surgical or medical procedures, and this anesthetic drug it provides 5 more important benefits. The first one is to sedate the patient and reduce in his or her anxiety and also lack of awareness and amnesia. The third one is skeletal muscle relaxation, which is very important for any procedure, and also it suppresses the undesirable reflex, and also it provides analgesic effect. No single agent can provide all these desirable properties. Several categories of drug are combined to produce the optimal anesthesia. And some of these drugs we call them pre-anesthetics. These pre-anesthetics help to calm the patient and relieve the pain, and also it prevents the side effect of subsequently administered anesthetic. And the most common used pre-anesthetics are, the first one is H2 and histamine 2 blockers, which are like famotidine or ranitidine, and these drugs are used to reduce the gastric acidity. Also, patients can be given benzodiazepines like diazepam or midazolam to reduce anxiety and facilitate amnesia. Non-opioids like acetaminophen or opioids like fentanyl can be used for analgesia, and also antihistamines like diphenhydramine can be used to prevent allergic reactions. Antiemetics like ondansetron can be used to prevent nausea. Anticholinergics like glycopyrrolate can be used to prevent bradycardia and secretion of fluids into the respiratory tract. General anesthesia has 3 stages, which are the induction stage, the maintenance stage, and also the recovery stage. Induction is the time from the administration of a potent anesthetic to the development of effective anesthesia, and this stage it depends on how fast effective concentration of anesthetic reach the brain. Intravenous drugs like propofol are mainly used for the induction of anesthesia. While maintenance stage, it is when sustained anesthesia is provided, and at this stage, vital signs and the response to the anesthesia are monitored continuously to balance the amount of drug inhaled or infused with the depth of anesthesia. And maintenance is commonly provided with volatile anesthetics because they offer good control over the depth of the anesthesia. While recovery is the time from discontinuation of the anesthetic until consciousness and protective reflexes return. And because it is the reverse of induction, it depends on how fast the anesthetic diffuses outside of the brain. At this stage, the patient is monitored for the return of consciousness, and also it is monitored to assure full recovery with normal physiological functions. Okay, the depth of anesthesia has 4 sequential stages, which are characterized by increase in central nervous system depression as the anesthesia accumulates in the brain. The first stage is analgesia, and at this stage the patient progresses from consciousness to drowsy. Amnesia and reduced awareness of pain occur as stage 2 is approached. And the second stage is excitement, and the patient displays delirium, and also a rise in an irregularity in blood pressure and respiration can occur, as well as of the risk of laryngospasm. And also because we want to shorten and eliminate this stage, so we can use like rapid acting intravenous agent before inhalation anesthesia is administered. Like we use the anesthesia with intravenous drug, and then we continue with the inhalation drug. The third stage is stage 3, which is a surgical anesthesia. Here there will be a gradual loss of muscle tone and reflex. The regular respiration and relaxation of skeletal muscles with eventual loss of spontaneous movement occurs, and this is the ideal stage for the surgery. The fourth stage is the medullary paralysis, and here severe depression of the respiratory and vasomotor center can occur, and ventilation and also circulation must be supported so that we can prevent death. Inhalation anesthetics are mainly used for maintenance of anesthesia after the administration of intravenous agent, and they mainly work by increasing the sensitivity of the gamma aminobutyric acid receptors to the inhibitor neurotransmitter GABA. An example of these inhalation anesthetics are the halothane, isoflurane, disflurane, sevoflurane, and nitrous oxide, which acts by inhibiting the glutamate receptors, especially the NMDA receptors. Halothane is the prototype of the anesthetic to which newer inhalation anesthetics are compared. Halothane is a potent anesthetic but a relatively weak analgesic, thus it is co-administered with nitrous oxide, opioids, or local anesthetic. And because it is pleasant to order, it is suitable in pediatrics for inhalation induction, although it is a new drug which is sevoflurane is the new agent of choice. And this drug, because of its side effects, it has been replaced in most countries. The second inhalation anesthetic is isoflurane. This drug, because it has a very pungent odor, it can stimulate respiratory reflexes like breath holding, salivation, coughing, and laryngospasm, and therefore it's not used for inhalation induction. And because it is highly soluble, because it has high blood solubility, it is typically used only when the cost is a factor. This flurane has a very rapid onset and recovery due to low blood solubility, and this makes it a very popular anesthetic for outpatient procedures. And also because it stimulates respiratory reflexes like in isoflurane, it is not used for inhalation induction. And because it is relatively expensive, it is rarely used for maintenance. Sevoflurane has low pungency, and this allows rapid induction without irritating the airways. And also it is suitable for inhalation induction in pediatric patients. It has a very rapid onset and recovery also due to its low blood solubility. Lastly, nitrous oxide is a non-irritating potent analgesic, but it has weak general anesthesia effect. Nitrous oxide alone cannot produce surgical anesthesia, but is commonly combined with other potent agents. It does not depress respiration, and it is probably the safest of the anesthetics. Intravenous anesthetics, they provide rapid induction, and an example of these IV anesthetics are propofol, barbiturates, benzodiazepines, opioids, etomidate, ketamine, and dexmedetomidine. We will go through them one by one. Starting with propofol, it is IV sedative hypnotic drug, and it is widely used, and it has replaced thiopental as the first choice for induction of general anesthesia and sedation. An example of barbiturates is thiopental, which is an ultra short-acting barbiturate with high lipid solubility, and it is a potent anesthetic but very weak analgesic. And because it had side effects like apnea, coughing, chest wall spasm, laryngospasm, and bronchospasm, and it has been largely replaced with new agents which are better tolerated like propofol, and it is no longer available in many countries including the US. An example of benzodiazepines are midazolam and diazepam, and also lorazepam. These benzodiazepines are used in conjunction with anesthetic for sedation, and all of these, they facilitate amnesia while they are causing sedation. Opioids are very common analgesics. They are commonly combined with other anesthesics, and the choice of opioid is based primarily on the duration of the action needed. And the most commonly used opioids are the fentanyl, sufentanil, and ramifentanil because they induce analgesia more rapidly than morphine. They can be administered intravenously, epidurally, or intrathecally. And we have to know that the antidote for opioids is naloxone. Etomidate is a hypnotic agent which is used to induce anesthesia, but it lacks analgesic effect. And one of its benefits, like it has little or no effect on the heart and circulation, and it is usually only used for patients with coronary artery disease and or cardiovascular dysfunction. Ketamine is a short-acting non-barbiturate anesthetic. It is beneficial in patients with hypovolemic or cardiogenic shock and also in anesthetics because it stimulates central sympathetic outflow, causing stimulation of the heart with increased blood pressure and cardiac output, and also it is potent bronchodilator. And it is used mainly in children and elderly adults for short procedures. Dexmedetomidine is a sedative used in intensive care setting and surgery. And what makes this drug unique is that it has the ability to provide sedation without respiratory depression. And its mechanism of action that is alpha-2 receptor agonist in certain parts of the brain. Apart from its sedative effect, it also has analgesic effect, sympatholytic effect, and anxiolytic effect that balance many cardiovascular responses. One of the very important pre-anesthetics are the neuromuscular blockers. These drugs are used to abolish reflex to facilitate tracheal intubation and provide muscle relaxation as needed for surgery. And their mechanism of action is the blockage of nicotinic acetylcholine receptors in the neuromuscular junctions. An example of these drugs are the cisatracurium, pancuronium, rocuronium, and vicuronium, and also the depolarizing drug, which is succinylcholine. That was for general anesthesia. There is also another way for anesthesia, which is the local anesthetics. These local anesthetics block nerve connection of sensory impulses, and in higher concentration, motor impulses from the periphery to the central nervous system can be blocked. So basically, sodium channels are blocked to prevent transient increase in the permeability of the nerve membrane to sodium that is required for an action potential. And when propagation of action potential is prevented, sensation cannot be transmitted from the source of the stimulus to the brain. An example of local anesthetics that's commonly used are the lidocaine, bupivacaine, mepivacaine, ropivacaine, tetracaine, and brocaine. That was all for this subject. Thank you for watching. Please don't forget to subscribe to this channel.